So good morning everybody. Today we will be learning about this anti-amoebic and anti-protozoal drugs. Have you heard of amoebiasis? Intestinal amoebiasis? Extraintestinal amoebiasis? Can you name some protozoal diseases? Can you name some protozoal diseases? Protozoa. What organisms you are seeing on the board? Are they protozoans? Are they protozoans? Human body is such a complicated system, but still the single cell organisms can destroy so much. Okay, so this amoebas, protozoas, no doubt they have the definitive treatment compared to the previous class, such as antifungal drugs. We do not have completely the definitive treatment. Here in this case, we have the definitive treatment in the earlier phase of the disease. If it becomes chronic, like hepatic amoebiasis and all, it becomes difficult to treat the conditions. And if the patient is already having immunocompromised conditions, treatment taking chances rate will be higher. Otherwise, we are dealing with the completely curable diseases now. So, super infections, what is that? What happens in HIV syndrome, AIDS? So in these cases, what can happen? There can be super infections because the ramp post is there which can decrease the immunity, and the next attacking post will be the less severe form. It may present a severe symptoms. So coming to the classification of this protozoal anti-amoebic drugs, okay, we have divided them into tissue amoebicides and luminal amoebicides. Okay, in tissue amoebicides we have intestinal and extraintestinal amoebicides, where we have the prototype drugs, that is metronidazole, tinidazole and ornidazole. Believe me, in this season they are sold in tons and the market is out of stock. So in this season it is very much common that we come across these diseases. Okay, diarrhea and vomiting and gastrointestinal infections are common in this season. Okay, so because lot of unhygienicity, the rainwater will be there and there will be more chances of contamination. So metronidazole, tinidazole and ornidazole. Okay, we have other drugs such as amidine, dihydroamidine. Have you heard these terms before? Amidine, dihydroamidine, ergotamine. Okay, so amidine, the name itself suggests they are the agents which can induce the vomiting. Okay, so extraintestinal amoebicides. Have you heard of this? Chloroquine, antimalarial drugs is over for you. Yes, chloroquine, hydroxychloroquine, all these drugs are there. Okay, they can also act as the extraintestinal amoebicides. Luminal or intestinal amoebicides, we have amides, diloxanide, furoate, 8-hydroxyphenolase, that is diiodopine or iodophenol. Antibiotics, tetracycline and paromycin. Paromycin belongs to aminoglycosides. Tetracycline is a broad spectrum antibiotic. So here we are speaking about the fecal-oral contamination. Okay, whenever the fecal matter gets contaminated with the food materials or the vegetables which you are using, okay, they may not be hygienically prepared. Maybe like it bringing the transport it between the at the production site, all these areas there can be fecal-oral contamination. So once the cysts are ingested, okay, you can see here they form the trochozoites, multiplication of the trochozoites within the colon, where we have the systemic amoebicides such as chloroquine, dihydroamidine and the emmetine. Okay, once there is hepatic invasion, we should use this hepatic amoebicides. Okay, so both luminal and systemic activity we have this metronidazole. Okay, and here you can see the diloxanate furoate. Okay, where the paramonoisin and iodophila. These are the drugs which can be used for luminal amoebicides, mixed amoebic infection and systemic amoebicides. So once cysts are discarded, if there is again chances of recontamination, the chances of recontamination increases most commonly when there is a baby in the family. Okay, small baby is there can be mishandling of the diapers and also cleaning methods. So that's why we need to be careful about this, and we should advise the patients when they are repeatedly coming with their symptoms. So metronidazole, it is a prototype nitroimidazole. Okay, have you heard this term, imidazole? Yes. Where else you have heard? Proton pump inhibitors are imidazoles. Okay, so it's a prototype nitroimidazole here. So highly active amoebicide, selectivity of this nitro group, it has this antibacterial action. Once this drug enters this anaerobic or the susceptible organisms, this nitro group will be reduced. This nitro group is toxic to these organisms. Okay, so but in humans this nitrogen enzyme is absent. So that will provide the selectivity. Okay, so by this action it can be anti-amoebic and anti-trypanosomal. It can act on protozoa and giardia. So here the enzyme which is important is PFOR. Okay, this is the pyruvate peroxy oxidoreductase enzyme. Okay, that enzyme is inhibited here. So once that enzyme is inhibited, the further downstream action are prevented. Okay, so oxidized DNA and protein, and there is oxidative damage. Metronidazole, it is selectively toxic to anaerobic organisms, and it enters the cell by diffusion, and then this nitrous group is reduced by the redox proteins to highly reactive nitro radicals which can kill these organisms. In the outpatient department, metronidazole is the most common and cheaply available drug. And the 10 tablets cost to be just 10 rupees, and most of the cases with pulmonary infection, the initial line of treatment will be giving this metronidazole 400 mg 3 times daily for 7 days. Okay, so giardia and giardiasis that can be prevented, and also trichomoniasis, which will be the common agents which can cause the infection in females. So next we have this combination of the drugs, that is ofloxacin, the ciprofloxacin is combined with this tinidazole or albendazole. Okay, so ciprofloxacin, that's the popular trade name which they use for this gene. Okay, so it can be widely distributed in the body, metabolized in the liver, and excreted in the urine. Plasma half-life is about 8 hours. That means TID dosage or 3 times daily dosage. We use it for amoebiasis, giardiasis. Okay, amoebiasis with the Entamoeba histolytica, it is the drug of the choice. In giardiasis, again it is treatment of the choice. Giardiasis again present with in the form of abdominal cramps and diarrhea. Amoebiasis has a similar presentation. This trichomoniasis, they present with the discharge and itching, okay, and with bacterial infections. in case of this gastroenteritis, most commonly we treat both these cases. Okay, so we think about the aerobic and anaerobic infections. In anaerobic, this is taken care by our metronidazole, and aerobic we usually combine the ofloxacin. So pseudomembranous enterocolitis, there also it is helpful. So adverse effects, as it is orally given drug, most of the time we have both the preparations. Okay, orally and intravenous preparations are available. Orally, it can be GI irritant, causing this metallic taste, anorexia and nausea. The drug itself can cause loose stools. Okay, this metallic taste is typical to this metronidazole and tinidazole. Okay, or ridazole. All these three drugs, they have typical metallic taste. Then contraindication, we don't use it in neurological disorder, first trimester of pregnancy and chronic alcoholism. Why we should not use it in chronic alcoholism? So a lot of students know the answer. So see here, what we can expect here is a disulfiram-like reaction. Okay, here we have an enzyme, iodine, which can be blocked by the disulfiram. Okay, once alcohol is consumed, ethanol, it is converted to acetaldehyde then to acetate. So here iodine enzyme can be blocked by the disulfiram, but also by our metronidazole. Any other agent? Risoformin. Then okay. So here what can happen? Abdominal distress, nausea, vomiting, flushing, headache, all these things, hypertension are due to the accumulation of the byproduct acetaldehyde. So this can cause problems. Then enzyme inducers like phenobarbital, rifampicin, they can increase the metabolism of this drug. Cimetidine, enzyme inhibitor, can reduce the metabolism. If lithium is co-administered, lithium metabolism is inhibited and lithium toxicity will increase. Okay, it can potentiate the anticoagulant effect of coumarin derivatives, that is warfarin. That means warfarin metabolism is decreased, and you must be remembering warfarin is a highly toxic drug when its metabolism is decreased because of its high plasma protein bonding, and even if a small amount of drug is released from its binding position, there will be more than 5 to 6 times the action. Coming to the next drug, that is alkaloids emitting and dihydroemitting. Alkaloids means natural derivatives. Okay, it is a potent and directly acting aminobutyrside. It acts on the tissue trophoblasts and causes irreversible blockade of this protein synthesis. The negative point about this is here it gets accumulated in the kidneys, so it cannot be used for longer duration. As by the name we know, this drug is emitting. Okay, it cannot be given by orally. So chloroquine, do you remember the mechanism? Yes, anyone? Chloroquine mechanism. I am not putting so that you all will be knowing that antimicrobial class is over. Yes. Chloroquine. Okay. Anyone? Timprimozoin. Okay. This thing is a toxic product and it can cause the cell lysis. Okay, that part is inhibited here. And in a similar way, it can be toxic here also. It is used in extraintestinal amoebiasis. It kills the trophozoites of the endomyelitis stenotica and attains higher concentration in liver. That's why it can be used in hepatic amoebiasis. Okay, and it's also an antimalarial drug. You all know that. This chloroquine is a anti-protozoal drug. Okay, and anti-protozoa, malaria is caused by? Is it a protozoa? Yes. So it is used in combination with metronidazole as a luminal amiloidoside for this amoebic liver disease. Amoebic liver disease, it so happens that the pus formation is so much so that this pus can completely enlarge the liver, and sometimes a Crohn's tract can be formed in the intestine also. Such dreaded will be the disease, okay, if it is not recognized in the earlier stages, and there we need to treat this very aggressive treatment in the necessary cases. Do you have this chloroquine in oral formulations or intravenous? Both are available. Okay. So Nariko, the popular trend name, comes in 52 milligram tablets. Okay, for 7 tablet blister pack will be available. Okay. So this chloroquine is also available for intramuscular and also intravenous use. Diloxanate furoate, okay, it is the drug belongs to this group. So it is a highly effective luminal amoebicide. Okay, it is a drug of choice for intestinal and asymptomatic amoebiasis and less effective in invasive dysentery. Here, there are very few drugs where the drug which is observed will not be functional. This drug is something like that. Okay, this drug gets split up and diloxanate furoate, and this 90% of this will be excreted in urine. You can see here diloxanate is observed, conjugated and excreted in urine, and this 90% is full of no use, because only the 10% which is available on the intestinal surface, okay, unobserved, it will be helpful in treating our infections, asymptomatic luminal infections, and it can be given with metronidazole. Do you remember some drugs in a similar fashion? The observed drug will not be effective, but the drug which is available at the intestinal surface will be effective. Most of them for getting the laxatives and also the statin. Okay, they have the similar work. So side effects, it is well tolerated and it can also cause this flatulence and urticaria. So urticaria, again, it's an allergic reaction. So iodophenols, okay, iodophenols is halogenated 8-hydroxy hydroquinone. It is a luminal amoebicide and commonly used along with this metronidazole. Iodide content can it cause some toxicity? Iodine. Do you remember some iodine preparations given orally? Glucose iodine. Any other agents? See, iodine in low quantity can cause toxicity and also in excess can cause toxicity. Okay, so this iodophenols, it can kill the cyst forming trophozoites in the intestine and is used for prophylaxis and treatment of non-specific diarrhea, travelers diarrhea and also dietary disturbances. Once the organism enters the intestinal wall, these luminal amoebicides will not be effective. Okay, so once there is extraintestinal manifestations and it has invaded this wall, these drugs will not be helpful. So commonly we combine two drugs, okay, intestinal and luminal amoebicides, and it should be taken the means to avoid this GI side effects. So iroquinol, it is a GI irritant, okay, nausea, crossing, loose stools are common. Goiter can occur after prolonged use. Okay, so you remember for goiter, how do we treat? What is the national program to prevent the goiter? We are using iodized salt. But sometimes if it is preparation like this, after long time use, it itself may cause enlargement of the gland. Repeated use of high dose can cause neuropathic syndromes such as subacute myelooptic neuropathy. This drug is contraindicated in optic neuropathy, renal disease, hepatic disease. Okay, in all these conditions, we should not use it. That is, the hepatic disease if it is a non-hemolytic origin. So pharmacomycin, again, it's a aminoglycoside antibiotic. Okay, here it is not significantly absorbed from the GIT as was our diloxanate furoate. Okay, and it is a luminal amoebicide. It can accumulate in the renal tissue and cause toxicity. In case of this asymptomatic patients, it is better than the diloxanate furoate. And pharmacomycin parenterally can be given for visceral leishmaniasis. So, what are the other effects of this aminoglycosides? Nephrotoxicity, ototoxicity, neuromuscular blockage. All these are there with our pharmacomycin also. So, what else we should remember about this aminoglycosides? These are highly ionized compounds. Okay, so any other antibiotic should not be used within a short duration, or it should not be combined. Commonly, what happens? They tend to use this cephalosporins and an aminoglycoside together, which need to be avoided at least for few minutes. So giardia is a common commensal found in the intestine. Okay, it can invade the mucosa and cause diarrhea. So we have this metronidazole and pindofluor commonly used. Metronidazole usually it is used in the dose of 400 mg, but for this purpose we can use this for 400 mg 3 times daily for 7 days. Mepacryne and furosemide, these are also used. Trichomoniasis, have you heard of this condition? So the most common condition are vulvogenital infections. Okay, and most of the genital lesions are due to this common organism. Okay, so the treatment is metronidazole 400 mg 3 times daily for 7 days. Here we can also use this intravaginal drugs, clotrimazole, pindofluor, and dihydroxypyr. So in these cases, we need to treat both the partners. Okay. So the proper counseling and the treatment of both the partners will prevent the recurrent infections. So coming to drugs for is provided by the no. Okay, so African sleeping sickness, American sickness, what is that? Okay, it is less common in India. The drugs used here are suramine, pentamidine, melarsoprol, eflornithine, and in American trypanosomiasis by trypanosomiasis cruzi, we use this drug, nicotinamide and benzimidazole. So, leishmaniasis, have you heard of this? Visceral leishmaniasis, cutaneous leishmaniasis. The drugs used here are the antimonials, sodium, stibogluconate, meglumine, and the diamidine. Again, pentamidine is used. And if you could remember, in the amphotericin, while discussing about this amphotericin, we discussed that this can be used in leishmaniasis, ketoconazole, and allopurinol. Do you remember where allopurinol is used? Okay, so it is a glucosidic drug. And in leishmania generally, visceral leishmaniasis, we can use this amphotericin B, and it is caused by Sancler. What is Kala Aza? It is also called as black water fever. So coming to this antimonials, that is sodium stibogluconate. It is a drug of choice for Kala Aza. Its mechanism is inhibition of the SH-dependent enzyme and blockage of the glycolytic and fatty acid oxidation pathways. So side effects are metallic taste, cough, abdominal pain, or this disorder. So coming to the next drug, diamidine, that is pentamidine. It is an aromatic diamidine. It is given by parenteral route. Here the mechanism of action is inhibition of the cytoplasm and thereby DNA inhibition and inhibits the topoisomerase 2. Do you remember some drugs which can inhibit this topoisomerase? DNA dihydrogenase, monoclonals, anything else other than steroids? Any antiviral drug? Antiviral is over? Antiviral drug which can inhibit this topoisomerase. So it will interfere with the aerobic glycolysis. So you can get a fission topoisomerase inhibitors. So collect the three drugs which can inhibit. So it is not effective in CNS. Pentamidine, its CNS penetration is low and is not effective in trypanosomiasis of the CNS. So it can be used in pneumocystosis, African trypanosomiasis, and leishmaniasis. So in pentamidine, the toxicity is high after prolonged administration. There is sharp falling BP, cardiovascular collapse, and dyspnea. It can cause pancreatitis, liver damage, myelosuppression. Okay. It can cause cytolysis of this pancreatic beta cells, thereby what can happen? There can be sudden release of this insulin. Sudden release can lead to hypoglycemia. Coming to the next drug, that is suramine. It was earlier used in prophylaxis and treatment of this African trypanosomiasis. It acts by inhibiting the enzymes of the energy metabolism, glycerol phosphate dehydrogenase. Melarsoprol, it is a pharmaceutical trivalent anti-trypanosomiasis drug, okay, mainly used to treat trypanosomiasis with CNS infection. Pentamidine could not cross the CNS, so melarsoprol can be used. Again, it acts by reacting with the SH group of this enzyme. This energy metabolism and the SH group action is the main mechanism of this anti-leishmanian and trypanosomial drugs. Have you heard of this Chagas disease? Megacolon, mega spleen, mega liver. It is also called as this Megas disease. Okay. So this Chagas disease, nitrofurantoins, it is used in the treatment of this trypanosoma cruzi. It acts by again generating this superoxide and hydrogen peroxide radicals. And this superoxide, which can be trapped by this catalase, they are lacking this, and thereby it can be sided to these organisms.